seniors need insurance, but we don't always know which type we need or what kind there is, including long-term care insurance. Today I have with me Joan Branin. She is a certified financial planner and she specializes in long-term care and Medicare planning. Joan, thank you very much for having me, or for coming on the show.
Well, thank you. It's my pleasure.
Absolutely. So choosing insurance, even though it's Medicare, it can still be very confusing for a senior. So describe the pieces within Medicare that are important for a senior to be considering when they're selecting their insurance.
Well, with respect to long-term care insurance, one of the things that seniors don't always realize is that what Medicare covers is for medical expenses, but what Medicare doesn't cover for is your personal care need expenses.
Which is expensive.
It's very expensive.
Right.
And they're usually last over a long period of time, and so people are very much taken by surprise as to the magnitude of the cost and the length of the need.
Right. So right now in California, skilled nursing, at least in Southern California, can be anywhere from about $6,000 to about $12,000 a month. It can be similar, it can be less, but it can be similar in assisted living.
Right.
Is that something that long-term care insurance covers?
Yes, long-term care insurance is meant to cover your personal care needs, which are things like your activities of daily living, and also if you have dementia, it will also cover someone who may be physically able but yet has a mental impairment. And basically what you want to do is buy a policy now while you're able to qualify for it medically, and then while the premiums are lowest, and then when it's time when you actually need to use the benefits, that money will be all in place for you, and you can concentrate on hiring the kinds and types of people that you really need and be much less concerned about the cost of those services.
Lots of the long-term care insurance policies cover home care as well, correct?
Yes, yes.
Okay, so it really gives you freedom and options and the support. And you know what I really like about long-term care insurance too is especially when you don't have a close decision maker or you're worried about a decision maker, that money will forcibly be spent on you through your long-term care insurance policy, correct?
Exactly.
So it really protects you.
Exactly. That's what's nice about long-term care insurance, because when people are starting to age, they really have a couple of things to keep in mind: their retirement planning and saving for it, and then also their long-term care needs. And so if you get a long-term care policy, all that money is there for you within the policy so that you can either stay at home and age in place, or at some point where it's just not best for you to be at home, you have the money to go into a nursing home. And plans now include both nursing home and home health care benefits.
What is a good age to consider getting a long-term care insurance policy?
Okay. The younger the better, because it affects your ability to qualify and also the cost of the premium. Most people aren't using the benefits until closer to age 80. But many people now are getting policies in their late 40s and 50s, especially in their 50s and early 60s as part of their pre-retirement planning.
Okay. We don't have a whole lot of time, but describe a little bit about the Medicare benefit. Then once you qualify, you're 65, and you're ready to go into Medicare. You help with those selections as well.
Yes, the other thing I do is I work with people who are under 65 and who are now aging into Medicare, and help them select which Medicare policies would best for them. They're going to get their benefits a certain amount through Medicare, but then they're going to need to supplement what Medicare does not pay for with a supplement policy, as well as Part D, which is the drug benefit, or the other alternative they have is the Medicare Advantage plans. And seniors can get a little bit confused, even people who are approximately my age, in reviewing all of these options.
It's
yes,
confusing.
Exactly, because there's a lot of choices.
There are.
And sometimes one spouse will be retiring and leaving their employer, and their spouse will be younger than they are, and then they have to stay on a regular health plan. So I do assist a lot of older adults with both a combination of Medicare planning and also when they need to still stay on the Affordable Care Act insurances that are available.
Joan, how would somebody get a hold of you if they wanted to review a plan with you?
Oh, sure. They can just give me a call. I'll give you my direct line later on, as well as they can email me.
What is your email address?
It's J Branin, Branin, C like Charles, F like Frank, P like Paul, @gmail.com.
Fantastic. Thank you so much for joining me today. I really appreciate it. It goes fast.
Yes.
A lot of important information, so
Yes.
I hope people will reach out and know that they can get the specific information for their needs.
Okay. Thank you very much. My pleasure to be here.
Absolutely. That's it for our show today, our special edition on seniors. I hope that you will tune in for our next program and to our next season. And we want to thank our crew, fabulous crew, for all the work that they do. Also want to thank our sponsors, EH Financial, Color Dots, the Smile Agency, NGOC Financial, Foothill Transit, and the ROP here right on our San Gabriel Valley campus. And we also want to announce that we have social media. We're on social media. I always get this wrong, but we are crowncitynews.com. You can find us on Facebook and Twitter. And I've heard that we even have an Instagram account that's very modern for our senior show. Again, thank you so much for joining us, and have a wonderful afternoon. Thanks. Thank you.
Good. Well, thank you.